Dr. Rick Barrett here. Today I want to answer a very important question that patients often ask, and that is, Doctor, why do I need x-rays of my spine? Is it really that important? So what I've done is gone through some of my archives, and I found some very interesting cases, and I'd like to share one of them with you today. As the saying goes, a picture's worth 1,000 words. So let's have some fun looking at this x-ray. Now this particular x-ray is on a patient of mine. His name was Mark. At the time, he was 72 years of age. I'll explain more about Mark in a minute. Well, let's take a look at some films. There are three distinct regions of the spine that we need to look at: the cervical, thoracic, and lumbar. So that's the neck, the upper back, and the lower back. We're going to start with the cervical, and we're working our way down the spine. So from the rear, the spine should be perfectly straight, just like this picture right here. Spinal nerves exit the foramen. So if we look at a model, we have the disc, the foramen where the nerve root comes out, that exits right off the spinal cord. So the brain sends signals down the spine, through the cord, out through the nerve roots, and then through the thousands and thousands of nerves running throughout the body. So this spine should be straight from the rear, and from the side it should have three distinct curves. A forward curve in the neck, an opposite curve in the mid-back, and another forward curve in the low back. So cervical, thoracic, lumbar, forward curve, reverse curve there. So when we look at Mark, we can see his mouth open right here because we want to see the first and second vertebrae, which are very, very important. Now, as I said, the spine should be straight. And what do we notice right away? Well, the spine isn't so straight, is it? It's quite curved. Now, we closed the mouth and looked at this section of the cervical spine, and we got a little bit of thoracic in the view as well. And you'll notice now very distinctly how that spine curves. Unfortunately, that's not the worst of it for Mark. Now, another key area to look at are these bright white circles all throughout here. That's this portion of the bone. That's called the spinous process. Now, that's the bumps that you feel in the back. They should all be lined up. They should all be centered, just like your nose is in the center of your face. What you don't want to see is these vertebrae rotated in any fashion, and I'm being extreme here with the model. But we don't want to see that vertebrae rotated in any fashion like that. That's going to pressure the spine, the spinal cord specifically, and the nerve roots. So we want to see very little rotation in there whatsoever. So when we look at Mark, we can see that he's starting to deviate quite severely towards the right side of his body. Now, we are looking at the spine from the rear. This is an important distinction. A lot of doctors, medical doctors, when they sit with you, they might show you an x-ray because they're sitting with you face to face and they're visualizing your body this way. So they'll usually put the x-rays up in that fashion. Most chiropractors, at least I can say for myself, I like to orient the patient from the rear. This is what I see generally when we're working on patient, although there's lots of different ways to adjust spines. But from the rear, the spine should be straight, as I said, and this view, this is the right side, just like you see here. This is the right side as well. So I'm going to orient you from the rear and then from the sides. So we see that the mouth is open, and that is fine. There's no problems there, but as we see, as we go down the spine, we start to deviate. We have quite a curvature as well as we have rotation. So the spine is deviating this way with a curvature as well as rotating. So there's two different directions the spine is going in that very short space. Now let's take a look at the lateral view. So this is from the side. Now this view is a tiny bit blurry, but hopefully you can see it okay. So we count down from the top, 1, 2, 3, 4, 5, 6, 7, and that's your first thoracic vertebrae right there. We want to see a forward curve in the neck. Well, Mark has a little bit of a curve, but from here to here it's fairly straight, as you can see. The big problem, you might have already identified it, is that that vertebrae right there is sitting forward considerably from the rest of the vertebrae. So we see the front of the vertebrae, the body of the vertebrae, they're all lined up here. These as well are lined up as we look at it. The back side or the posterior side of the vertebrae are lined up. But when we look at that one, so 1, 2, 3, 4, so at C4, his vertebrae is shifted considerably. Now, this is what we call spondylolisthesis. Big word just to say it's slipping. And in this case, it's slipping forward. It can also go retro, but this is going to the anterior. So you might imagine that's a very severe condition right there. Now, if you gaze above my hand for a second, and you see the vertebrae here and here, it looks very smooth, very nice. The disc space looks really, really good. I'd venture to guess that it'd be very hard for anyone to tell this man's age. Now, when we get here, we see a lot of degeneration in the spine. So we can probably determine that this is an elderly person or someone who's had a lot of trauma to their spine. And so if we look here again, we see that great slippage. And then again, we see disc spaces that are narrowing. The narrowing is not as critical to this particular patient as is the slippage or the spondylolisthesis. So you might imagine, it's very hard to do it with a model, but if we take that and we slip these vertebrae forward, you're going to put a tremendous amount of pressure on the spinal cord, these nerve roots. The joints themselves are going to bind, and we're going to put a tremendous load on all the surrounding tissue, ligaments, muscles, tendons, etc. So this is a severe condition that could cause this man quite a bit of trouble. Should he just take a simple slip and fall, maybe he falls off a curb, maybe he trips and falls off a ladder, he could have a spinal cord injury just like that. So Mark was not aware of this. We're going to discuss that more in a second. But this is an extremely important distinction, and one reason why it's important to take x-rays on patients. So a lot of patients will come in and they just want to have their back cracked or their neck cracked. They want to hear the noise. They want to get some pressure release. Well, in this case, we could have a severe problem. We can have a paralyzed patient or we can have a dead patient. That's not good. So, one good reason to take x-rays on the spine, to see what's there. If you don't see, you don't know, but if you see, you do know. So now we know how to treat this patient effectively and safely for his benefit. Let's take a look at a couple other x-rays now. Okay, so this is the rear view again. We are looking at his right side, on the right side of your film. Spine should be perfectly straight. Again, just like that picture right there. But what you're going to notice is this extreme, severe deviation of his spine. How would you like to have that spine? So now we have two sections that are in extreme trouble. His cervical spine, the neck again, with that slippage, the spondylolisthesis, and that is all coupled to the spine rotating and deviating off to the right side. Tremendous amount of pressure on his nervous system. Anywhere you have pressure on the nerves, your nervous system can fail to some degree. A little, moderately, severely, just depends on the person and their tolerance to it. So we never want to see something like this in a patient, and that helps us to determine how we can treat him. Again, safety is important. We want to make sure this patient doesn't have any trauma based on what we do. Now, if you thought that was shocking, let's take a look at another one. This should make you cringe right here. We saw the upper view, and now we're coming down into the low back or the lumbar spine. I'm sure you're probably getting sickened right now just looking at this. Can you imagine if this was your spine, your wife's spine, your daughter's spine, your son's spine? Not good. You would not want that in them, and you know their health would be compromised tremendously. Just look at his ribs. Right here, you can see these ribs coming down. They're riding right on the top of this bone right here. This is called the ilium, and that's the crest of the ilium right there, and you can see the severe pressure that's on his ribs and his ilium. As well, we talked about this portion of the bone right here, the spinous process. Well, as we come down, you can see the severe rotation now. Quite a bit of rotation in this spine. And the severe curvature. Of course, this is what we call scoliosis. Many of you have probably heard that term before. This is an extreme case of it. Now, this man has lived to 72 years of age, believe it or not knowing that he had a spine like this. I'll explain more in a second. So, if we look at the vertebrae again, we see that the outer edges of the vertebrae line up, as they should. Rear view. Now I'm just going to turn it around, it might be a little easier to see. So these vertebrae should line right up there. The ligaments hold them together, the tendons would be attached for muscles, but we don't want to see slippage one way or the other, laterally, to the left or to the right. We don't want to see that at all. And if you look, again in Mark's case, the left sides line up, the right sides line up, until we get to these distinct vertebrae right here. And now we have a severe case of slippage. So look at the distance between here and here. That is quite significant. Again, hard to do on a model, but you have severe wedging of the vertebrae here. So you're going to have a tremendous load on the spinal cord, the discs, and the joints. These joints, as they try to move, will then over time be roughened. They will act abnormally. Just like hitting a pothole with your car, you're going to knock that front end out of alignment. You can drive on it, but you're going to have excessive wear and tear over the lifetime of that vehicle. So here, we're going to have excessive wear and tear on those joints, but we're going to have a tremendous amount of pressure on those nerves and a tremendous amount of pressure on these discs. So at one time, the problem would have started with just that, and over time, he's degenerated and deteriorated. So he's looking more like this vertebrae, where we see a lot of degeneration in the vertebrae and in the discs themselves. So as you might imagine, and as we talked about in the cervical spine on Mark, he could have a minor car accident, fall off a ladder, trip just walking, and he can have a spinal cord injury just like that. This is a tremendous amount of pressure on all the tissue there. But the main thing is it's affecting his nervous system greatly. Regardless of whether he has pain or he doesn't have pain, the nervous system will be compromised. Wherever those nerves travel, wherever they travel out of the spine, they're going to be in trouble. So down here in the low back, right here, you're going to pick up organs like bowel, bladder, sexual organs. You're going to have nerves that go into the legs, into the buttocks, all the way into the toes. You're going to pick up your sciatic nerve on both sides. So a lot of pressure on that, a lot of rotation. So once again, here we have wedging. We have an extreme curve all the way through that lumbar spine. And we have severe rotation in the spine as well. Now we're going to turn this. We're going to look at the spine from the side. It's what we call the lateral view. So from the side, front of the body is here. This is the anterior portion, this is the posterior portion. Here's Mark's sacrum. That's the tailbone. You have 5 vertebrae in the lumbar spine. 5, 4, 3, 2, 1. So that's all the lumbar spine. His spine should be curving this way. I don't know if you can see it, but I put a line right there, a curve. And that is the curve that the spine should have. So he's lost that, and he's going the wrong way. He's actually reversing. You can imagine the tremendous amount of pressure on this man's low back. If you look at those vertebrae and discs, you notice a thinning. You can hardly see any disc in here anymore, hardly see any disc in here. Tremendous amount of pressure here. You have points on the vertebrae, and these points are what we call bone spurs. That's what I showed you a moment ago on this model. Instead of a nice healthy disc, nice healthy vertebrae, smooth squared off type vertebrae. Plenty of room for the nerve to exit there and do its job, sending information, neurological, electrical information, to the rest of the body, wherever that nerve travels, heart, lungs, liver, pancreas, thyroid, whatever it might be in the spine. Those nerves are fine here. But as we go down, we're losing the space in the disc, we're roughening the vertebrae. These are called bone spurs or osteophytes. And now we're trapping and killing the nerve. This is not even the most severe. This is. This spine is fused together at this point. These nerves are dying off. At this point, there's no hope for this. Not even surgery is going to be an effective answer for this problem right here. So, recap that. We have degenerative discs, we have bone spurs, and we have major compression on those nerves coming out of the spine, as well as mechanically is going the wrong way. So, two components that we deal with. The main component we always care about are the nerves, the spinal cord, and how that influences and affects the rest of the body. But secondarily, we're looking at the biomechanical structure. This is not okay compared to this. This is nice joint movement, and that is not. We're going to have wear and tear, as we see, over a period of time. Now, you're probably shocked, but when I sat and talked to Mark about this and showed him his x-rays, he was horrified. He was disgusted, as well as he was extremely angry. The question he asked me, which I had no way of answering, and he knew that when he asked it, was why didn't any of my doctors ever see this, ever tell me about it? Now, you're viewing this, and you're probably thinking the same thing. Someone must have told him somewhere along the line about his spine. But the reality is, no one did. So most of his life, he really didn't have pain. Hard to believe that as well. Some people tolerate different situations differently than others. Some people tolerate pain differently. So he really was relatively pain-free, other than what one would expect in a lifetime. He was starting to become hunched over, and he was having more pain, and he didn't know why that was happening. Doctors just told him it was his muscles. They were weakening, and because he was older, he automatically had osteoarthritis. So that's a term that people often throw out there, arthritis. So none of his doctors bothered taking x-rays of him. No one did an MRI on him. No CAT scan. So no diagnostic studies whatsoever. Just every doctor he went to said, oh, you're just getting older. You have arthritis. Don't worry about it. There's nothing you can do. Well, as I said, Mark was very shocked. He asked me that question. There's no way to answer it. Why any of his doctors didn't help him, didn't give him the answers that he needed. He said something very telling after that as well. He said, 40 years ago, I could have done something about this. What can I do now? And the answer is, he can't do much about it at this point in time. But 40 years ago, he wouldn't have been this severe, and if he had gone to a chiropractor 40 years ago, he could have had help with his spine to eliminate the pressure on his nerves and hopefully get some spinal correction in the vertebrae. Sometimes we can get a lot of correction, sometimes we can't get that much correction, but you can always take pressure off the nervous system. He would have had a healthier life in terms of his general health, not just the pain relief, and he wouldn't be in this situation. More than likely, you never know 100%, however, more than likely, we would have kept him, some chiropractor, multiple chiropractors along the way of his life would have kept him from getting in this horrible, horrible condition that no one can do anything about, but giving him a little pain relief day to day. And that's about it. You can improve the quality of his life very little, but anything we can do for him is better than where he is now. So he had to accept that, but he was very frustrated with it. So Mark had a very interesting life. He was in World War II, and he was one of the people that went into Hiroshima after the bomb had been dropped. So after the war ended, we sent troops into Hiroshima to help with the devastation, to help the people that were survivors, and to help clean up the city. And Mark was one of those people. one of the questions that came up was, do you think that going into that area with the radiation would have affected my spine? And once again, there's no way to really know, but it's an interesting thought. When you're in the military, you have lots of examinations. Now, he was an officer, and you know that he had examinations during that period of time, but no one had caught any problem with his spine. Maybe it wasn't there at that point in time. He has told me that he had no x-rays taken then. Then in the civilian world, he was a professional, had a good career, and he had many different doctors throughout his lifetime. He was an intelligent man, but no one ever helped him by diagnosing him through an x-ray, again, or any other test such as MRI or CAT scan. So I brought this case to you just to share with you the importance, obviously, of taking x-rays on the spine. Not everyone is this extreme, obviously, but it's the minor misalignments of the spine over a period of time that can affect you. On some people, maybe it takes 5 years to have a problem. Another person might take 10, 20 years. Another person might take 40 years. What Mark said was very chilling, right? And very telling. Why didn't anyone diagnose this? Why did none of my doctors tell me about it? And 40 years ago, I could have done something to help myself. I think those are all very, very critical and distinct points that he made. I treated Mark for many, many years, helped him daily. Well, not daily, I didn't see him every day, but throughout his lifetime, I helped him to achieve some pain relief, to walk a little straighter, to improve the quality of his life. I was very pleased to be part of Mark's life, and I thank him for that. One of the things he charged me with after we saw these films, he said, "Doc, I want you to show these films to everyone and anyone you possibly can. Anyone that you deem should see these films, please show them to them. Because I don't want another person suffering all the years and waiting 40 years to handle a problem that could have been handled in the past. Or maybe not even be able to handle a problem because it's too far gone." So over the years now, I've shared his films with many, many people. And I took this opportunity to share it with a bigger population. And hopefully you guys out there will share this and send other people to this site so that they can see his x-rays. Now, again, not everyone is as severe as Mark. Thankfully not. I have other x-rays that are very interesting, x-rays that we've found cancer on patients, early degeneration in younger people that otherwise you would think shouldn't have it. So there's some other interesting cases I think I can share with you, and I hope you enjoyed this one and enjoyed me talking about it. You never know what your spine looks like. You might have a thought that you do, but unless you take an x-ray, which is very inexpensive in the term scope of diagnostic testing that we have, is a very valuable tool. It's much more inexpensive than an MRI or certainly a CAT scan. Very little radiation compared to many things that we do, especially CAT scans. So I think it's very valuable to have this information, to be able to have it as a doctor and to be able to have it as a patient, and so that the doctor does no harm to you by treating your spine when you could have an underlying condition that you don't know about. So I hope this has been helpful to you. Share this with other people, let them know about it, and if you see a chiropractor, please make sure the chiropractor is taking x-rays of your spine. There are lots of reasons that doctors of every specialty don't take x-rays. It's hard to believe, but a lot of doctors, one, don't want to invest in the x-ray equipment. That's understandable. There are imaging centers, and there are also hospitals, of course, many places to have x-rays taken. We have x-rays at our facility. And a lot of people just don't see the value in taking x-rays because they think they can just feel your spine, palpate your spine, and get all the answers from that. A lot of us don't believe that's true. I would have had a feeling of what's going on in Mark's spine, but I wouldn't have known all the answers. So, many other reasons to share with you later on about why doctors do and don't do x-rays with their patients. But again, hope you enjoyed it. Thanks for watching. I look forward to sharing more with you in the future.